saying that Essex County is the second largest county geographically in the state and the third least densely populated. We have roughly 21 people per square miles, which makes it a unique medical response to, wait, I'm going to read this. I want to assure that everyone will maintain regular exercise emergency response plans and policies. We work with all of our health partners. We've been working with them to assure that plans and policies have been ongoing. The uniqueness of our geographic area is that different providers provide coverage in different areas. So to be in the healthcare system in Essex County is not one healthcare organization. That's what you'll see here today with the multiple agencies. This is not the first time we've met. We've met many, many times. We've drilled, planned, and prepared for this day. We have long-standing partnerships with our healthcare organizations standing here, as well as our county agencies to ensure the health and safety of our communities. I'd like to call out Don Jaquish, who's working as our Director of Emergency Services. He's working tirelessly to acquire the assets needed, necessary to make this threat of COVID virus have the proper materials and PPE we need. Patty Basho is the Director of EMS. She's training all of her EMS to respond appropriately to calls. Our County Manager is here today, Dan Palmer. He's provided me with any supports necessary to ensure the smooth transition from business as usual to the direct response and to support response activities related to COVID-19. Our County Attorney, Dan Manning, has provided me with vital guidance as we take necessary steps to assure that our residents are quarantined and isolated as necessary. Today, my count this morning was this. I have 5 people in precautionary quarantine. I have 14 in mandatory quarantine. I have 1 person in isolation, and we have 1 positive case in Essex County. This work requires an intense and professional staff, and I'm extremely happy to say I have that. Susan Allett is the Director of Preventive Services. She's working well with and alongside of Jennifer Newberry, the Director of Patient Services. These teams have been led and coordinated. I'm extremely grateful that the Essex County residents have held on to their community home health agency. And this time we were able to call up nurses because we have them in what's called a CHA. We've utilized them, we've trained them all in ICS 100. They all were fit tested. They've been fit tested every single year. We did not just plan this today. This has been an ongoing response. We're really grateful for volunteers that have showed up and helped with contact tracing, which is what's happening when we have positive cases. And we continue to secure the health and safety of our residents. We're confident that we will continue to meet the public health needs and our community members. So I'm going to wrap up and say, I have an ask of all of our residents. Please stay home. Avoid social gatherings. Practice social distancing. Wash your hands. Limit contact if you feel you're sick. And if you need to be seen, please call your emergency room or your physician prior to going in, and they'll direct you on the best way to do that. So I'm going to ask that we hold questions at this time, and I'm going to ask Dr. Kristen Mack to come up from Hudson Headwaters and talk to you about Hudson Headwaters' response.
Thank you, Linda. So I'm Dr. Kristen Mack. I'm from Hudson Headwaters Health Network. I'm the co-lead physician at the Ticonderoga Health Center as well as the Mariah Health Center. But overall, in terms of Hudson Headwaters, we cover many counties, not just Essex County, and we are working together in these kind of unprecedented times with unpredictable results coming at us here. So we are trying to provide patient care in a sort of unconventional way right now, working with these solid relationships like Linda had mentioned, and this shared commitment of health for our communities. We have taken many steps to help mitigate the COVID-19 impact and to ensure that our patients have access to their primary care provider and the important care that they need. We have implemented daily management meetings and enacted those to help us with guidance and plans, challenges and changes to the healthcare system, because as you can imagine, these are changing on an hour-to-hour basis. We have reviewed as a whole network people that are able to work from home, and we do have them working from home. People that are in patient-facing positions and essential personnel, we do have proper protection for. We have protective equipment that we are wearing. We do have triage nurses at every health center, so no one gets into the building that meets criteria. We do have drive-up testing and triage available at most of our health centers, or have diversion protocols in place for those that do not have that. For example, I'm at the Ticonderoga Health Center. We do have a physical space that is separate from our primary care space at this point. Every person that walks into the building is triaged, taken their temperature, and certain questions asked. If they fail that triage, they're asked to go back out to their car and go to a different physical part of the building. And the person that's doing that triage has personal protective equipment on. If they either fail triage at our front door or are calling in and have been recommended to come to us for triage and testing, like I said, we're doing that in a different part of the building physically from our other area, because this is the tricky part for us as primary care physicians, is we are trying to maintain being able to take care of our patients that are not COVID suspects but do have chronic illness or other medical conditions that need to be treated. We are looking forward, and we have contacted patients and postponed some appointments if they are over the age of 65 or have chronic medical conditions that put them at a higher risk right now of being away from their home in general in terms of those guidelines. But we do have our physicians who are making contact with those patients and allowing those questions to be asked over the phone. Otherwise, we've adjusted our staff workflow, patient movement, all through every health center building. I also echo what Linda Beers said. I have hair in my face right now. I'm not touching it. There's a reason. Don't touch your face, okay? Wash your hands. Even if it's silly, wearing gloves reminds me where my hands are at all times. Keep your distance from folks. And please, please, please pick up the phone and call if you have questions. A lot of our recommendations are to stay home and self-isolate, okay? Like I said, the guidelines are changing minute by minute, hour by hour, but we're happy to help guide you. That's all I have to say for now, but I'll answer questions in the future.
Switch squares.
Good morning. I'm David Quaz. I am the Director of Emergency Services and the Chief Medical Officer for Elizabethtown Community Hospital. We've all heard so much and been bombarded with so much information about this crisis. I don't want to repeat that. What I can say, though, is I think it's fair to say we've never experienced a situation that required a more rapid and coordinated response from both public health, from healthcare institutions, and from the public itself to try to prevent a greater catastrophe and to deal with what we have on hand. I can say that at Elizabethtown Community Hospital, we have been working nonstop internally with our UVM Health Network colleagues, with our neighbor institutions such as Hudson Headwaters, with public health, with the Essex County Public Health Department, to try to optimize prevention here, to provide appropriate screening, and to prepare for the possibility of a significantly larger influx of ill patients related to this crisis. Just a few points. We currently do have adequate equipment and supplies such as gloves, masks, gowns, eye protection, and such, which are essential to provide care safely in this situation. However, we recognize that we need to be responsible stewards of resources because we simply don't know if supplies will be available if our needs are significantly greater coming up. And we internally, I can say we've done a number of things to try to minimize exposure to infection for both the public at large and our staff, to try to maintain a healthcare workforce. We are significantly restricting access to the hospital in terms of a much more restrictive visitation policy to protect our patients, our staff, and the public from infection, and to stay in keeping with the spirit of severe social distancing to try to prevent spread. Sure. We are evaluating who can do their jobs, just as Hudson Headwaters, who can do their jobs remotely and still be effective. And in our clinics, we are postponing all care that is not time sensitive and essential to try to minimize traffic and minimize the potential for exposure. With respect to testing, it is no secret that the capacity for testing and supply has been somewhat limited. That remains the case. We hope that will change soon. However, for those people who it is appropriate that they, clinically appropriate that they be tested, we do have capacity, and we have developed a system to work with our colleagues and with our neighbors to provide appropriate testing in a manner that minimizes exposure to other individuals in the community and to our healthcare personnel. I think it's important to remember that the majority of healthy people who do contract COVID-19 infection have mild disease. It's characterized by fever, cough, and fatigue, and the treatment plan for those individuals is a treatment plan that we all know well in terms of rest, fluids, Tylenol or Advil for fever, and self-quarantine to minimize spread. There is no need for those individuals to seek medical evaluation in person necessarily, and doing so right now brings risks of infection to others without any demonstrated benefit. However, people with risk factors for more serious disease, people with advanced age, pre-existing heart or lung disease, diabetes, kidney disease, should have a lower threshold to contact their healthcare provider and seek guidance. And anyone with zero worsening symptoms should seek immediate care in an emergency department, as they would for any other condition. Much of what we're doing is geared at both prevention and, more importantly, gearing up our system for the possibility that this could be much bigger in terms of the influx of ill patients. But I can't overemphasize the fact that it is the public who really have to turn this around right now. The current situation is an enormous challenge, but it presents us with an enormous opportunity. The most effective means of combating this is the prevention of new cases, and the most effective way to achieve that is strict, severe social distancing. In this area, we actually are fortunate to be at what may be the very, very start of community spread of this disease. And so we are poised at the best point. This is the time where social distancing can have the most effect. This is the time when hand washing and restricting exposure is most effective. And also, this is the time when the time to do what people in the North Country already do so well, and that's look out for their neighbors. So I would really urge people to use every opportunity to ensure that the people in our community who may not have access to social support, may not ensure that they have access to food and other necessities, but to do so within the context of social distancing. And then I'm happy to take any questions at the end. Thank you.
Well, good afternoon. As Linda said, I'm Sylvia Getman. I have the honor of being the president and CEO at Adirondack Health. And most of you know us. We cover from point to point 50 miles of the beautiful Adirondacks from Keene to Tupper Lake. So we span a couple counties as well. And, relative to primary care recommendations, I think Good Doctor has done a great job of really outlining, I think, how we're all preparing. You've already heard that we're doing this in coordination And we really do things in rural areas that I think are extraordinary because we know how to work together differently, and I think we're pretty used to that overall. So I thought I would take a few minutes to talk about Adirondack Health and our preparation in maybe a couple buckets, and then certainly have questions afterwards. So, first and foremost, how we are organizing as a provider of care. And in addition, to the great things we're doing on our primary care clinics, very similar. You're going to hear the same kinds of preparation across. So I'll try to talk about the things we might be doing a little differently. We also have set up a COVID clinic. We actually are in kind of a serendipitous opportunity. We underwent a very large construction project at Adirondack Health at the medical center in Saranac Lake. And we had just vacated some space really adjacent to our emergency department that had been our previous ambulatory surgery unit. And that also has an exterior door and adjacency both to imaging services, our lab, and our emergency department. So we've been able to put in place it's lightly a drive-up clinic, but it's really a light screening site for those people that are symptomatic. We are screening people, as you heard. Every organization is at the doors, and then we're able to get them over and get them seen by a provider right there. We can also utilize that space for people coming into the emergency department, so we can quickly isolate, diagnose, treat if needed. We do have isolation rooms within that space as well. So we do have that up and underway. In the rest of the hospital, we've been preparing, and we've been preparing as a system for a very long time. Many of you know that we have what we call all hazards preparation and training, which means we regularly drill, prepare, and look for resources for a variety of different types of things, including a surge and infectious outbreak such as this could be. Certainly none of us have seen anything at this scale. And our mantra at Adirondack Health is we absolutely are preparing for the worst. We are worst case scenario planners. We absolutely hope for the best, and we are completely and well prepared to take whatever comes and do the great job that we have always done. So we have worked on also our long-term care facility we have in Tupper Lake. We've put procedures in place there. We're screening all of our staff there. We've restricted all visitation. We are monitoring that very fragile and at-risk population as well. And then we did, as Linda mentioned, have the first case that we've had in Essex or Franklin County identified. It was an outpatient. They were seen in our emergency department. We had all the appropriate protective gear for all of the staff that interacted with that individual. That individual is under the Department of Health's guidelines and is quarantined at home while they recover. So we are completely prepared for knowing and addressing the fact that this is not going to be the first or only in the area as we go. So we have a great team. All of this is a team effort across the entire county, quite frankly across the state. I've been in contact with my colleagues north and south and east as well in terms of making sure that we are working under the very best guidelines. Our biggest concern as a system currently is the availability of protective equipment and materials. We do have adequate supplies for now, but that is something that's strained and constrained at a local, state, and quite frankly, national level as well. So we continue to work with our partners to ensure that we have everything we need to appropriately care for the patients who have come to us and will be coming to us as well. The second role that I play is as an employer, and I am the largest private employer in the Adirondack Park, just about 850 employees. And so we are working very diligently to ensure that they stay safe as well. So we have implemented a non-domestic travel for business and educational purposes policy. We have people remote working as well, and we'll continue to roll that out as we can. We do monitor our staff to ensure that they stay healthy as well. And we're looking across all of our parts and pieces for creative ways to ensure that over a very lengthy event, which this is. We've been reminding people that this is not a 4-day snow or ice event, which is our more typical emergency here in the Adirondacks, that this is a long-term, exhausting, continuous event, and we need to make sure that our resources, our human resources, our most important resource, are well trained, well outfitted, well rested, and well fed. I should throw that one in as well, and are ready to care for each other. We have adapted to the fact with school closures. I think many of you know that that does impact workforce. And so we're trying to make sure that those folks who need to stay home and be with their families have that opportunity as well. So I think we're very prepared, as prepared I think as anyone could be in an unprecedented event. We are learning daily. I think the good news for the community is this is becoming more knowable. We have learned from China, we've learned from Italy. On a personal note, I have an aunt, uncle, and cousin under quarantine in Veneto, Italy, and I've been in contact with them as well relative to the processes that they're going through, and with some of the medical staff there as well. We're learning from our colleagues nationally, and all of those things will better prepare us to deal and provide the very best of care to the people of the Adirondacks. I think in closing, I think the third thing that we are and are prepared to be is really your neighbor. I love it when my major facility friends say, well, we care for you like friends and neighbors. We are your friends. We are your neighbors. We're probably your family as well. And so we really echo everything Linda said that says this is in your hands, literally in your hands. I know my eyes are watering, and this is going to look great, I know, on thing. But this is in the hands of both, it's our responsibility to give you the appropriate guidance, but it's really up to the community to step forward and take this seriously, and we are there to help you every step of that way. So thank you.
Morning. I'm Sean Galillan. I'm chairman of the Essex County Board of Supervisors. I would, first of all, I will talk about what we've done on the government side, the local government side, and then I'd like to kind of give a message to our community and to the people of Essex County. First thing is, this is a great challenge, and it's a danger to our community. Let's not make any bones about that. But I'm going to quote, I think, a great New Yorker who said something at the last greatest challenge, or past greatest challenge that faced New York and the country, and that is we have nothing to fear but fear itself. If we are there taking care of our communities, following the guidelines that public health, et cetera, puts out, then we're going to be okay. Panic and fear is counterproductive to actually beating this thing over time. I talked a little bit about what we've done on the local government side. Initially, when this thing was coming and stuff, we formed a task force between the Board of Supervisors and public health and emergency services, our healthcare providers, representatives from the state, now representatives from the federal government, and we talk daily between each other, and we have a weekly come-together task force meeting virtually by teleconference. Additionally, we speak to the governor's office. All the leaders of all the counties in the state speak to the governor's office on a daily teleconference to keep up with often the hourly changes that's coming down on the spread of the disease, and also the guidance coming down. We've had to take a look at what our mission is from the county government side and each of the town government sides, and if I condense it down, what we have to do on the government side is preserve our workforce. And that is, we can't have people getting sick or being exposed to it, because the whole department or a whole section or a whole function of our government may just go out because they have to be pulled out for isolation, quarantine, and stuff. So looking at that, we have at various levels have instituted, and often also under the governor's guidance, to have work toward this 50% presence and providing of services. So we've instituted working at home, splitting shifts, identification of folks that are have to be here, and identification of folks that don't necessarily have to be here, who don't have to come to a central space, but can work in the field. I would quote basically the thoughts of our county manager Dan Palmer, who took a look at what are non-essential personnel at the county level. We don't have any. Everybody here is essential. We break them up right now between our direct response people and our support response people, and their functions can change on a daily basis. You wouldn't think that cleaners right now would be our direct response essential personnel, but I guarantee the cleaners that come into these buildings and clean the office spaces and the areas that people work are absolutely essential to the continuing functioning and the preservation of our workforce. Everybody has a part in this battle against COVID-19. At the town levels, we have all taken a look and gone down to 50%, splitting shifts, sending people home, having them work from home, and most importantly, practicing social distancing, to the utmost, becoming almost totalitarian social distancers. To the people, I guess, of Essex County, we've been through this before, something like this. This government was established in 1799. And since that time, we've lived through wars and civil wars and tornadoes and blizzards and hurricanes, depressions, famines, and previous pandemics. Okay, we know how to take care of our community and get through this. I would give 3 words or 3 things to the people of Essex County: stay strong, calm your fears, and have faith. Thank you very much.
Questions? So at this time, if you have any questions, I think we'll do whoever is best to answer them.
Yeah, how many beds do you have countywide?
I don't know that off the top of my head. I didn't run it. It's changing every single moment. So when you talk about countywide, this will go back to exactly what I said today. There is one hospital in Essex County, and it's here, the Elizabethtown Community Hospital, but that's not the only hospital our residents go to, right? So we have Saranac. Oh, absolutely. I'm sorry, she asked me if I knew how many beds we had available in our hospitals. So again, there isn't just a hospital that everybody's going to, so Champlain Valley's taking people. Go ahead, Dr. Claus is going to answer that. There, back.
So the question is, how many beds do we have available in Essex County? Well, the short answer, but the deceiving one, is 25 beds right next door here at Elizabethtown Community Hospital. But the more important answer is that in the context of this particular health crisis, where the patients who require hospitalization often require rather advanced respiratory support, often on a ventilator with intensive care services, we already function as a critical access community hospital with strong coordination with hospitals that provide a higher level of care, namely CVPH and UVM Medical Center. And so we will continue to make the best use of our resources here, locally, but continue to decide which patients may arrive to us whose care would benefit from a higher level of services, and make use of our partners to provide that level of services while actually doing what we can to unload the work done at those institutions by optimizing the care that we can provide here on site.
I have a question for you. I'm Pam. Can anybody hear me? So some of the modeling in New York State is showing that peak spread of the disease will happen in about 45 years. Have you done any relative related modeling for this area?
So I'm not an epidemiologist. I'm not a modeler of these diseases. So the question is that there have been models done that suggest that the peak of disease may occur in about a month and a half or 45 days in this area. And have we done any local modeling? I don't want to speak for the Department of Health, public health folks. I am not an epidemiologist. I don't pretend to have that expertise.
Okay,
Yeah.
thank you.
I know Linda mentioned that some volunteers have showed up to help with contact tracing for that patient. Could someone just explain that further, who these volunteers are and what they've traced?
So volunteers are people, I should have clarified better. We have people that are essential to this county, but maybe not essential in the departments they've had. They've come and volunteered their time. They work in other departments. They're county employees. They volunteered to come answer phones for us. So tracing is a specific thing. And when we have a positive case, it is part of our practice, and we do this for all diseases. It's not unique. That we will contact every person that had contact with a person that has been positive. That requires lots and lots of phone calls and understanding the distance people had with them and the relationship to the person that we have in quarantine. So that's what we've been using tracers for. It's a scripted program. Did you see them? Were you in this place at this time? So that's the answer to that.
Is there anything you can tell us about the risk factors that were hit by the current case?
No. So the question was about the confirmed case risk factors. To my knowledge, the person did not have any previous risk factors. They happened to contract COVID-19.
Did they travel recently? That's what I mean, the
Oh.
risk criteria.
No, they did not travel. They were not travelers out of this country.
Is there, where are they from? Is there any information that you might be able to provide about
Yeah, we're not going to do that. I think that this community, we are tight and we're close. Even the slightest bit of information really identifies people. And we just have chosen, all of us together have chosen, we said that from the start, we are really going to try to protect our citizens and protect all of you because you don't know who it would be, and we're going to keep that integrity going.
Over at CBPH, they said that they're kind of putting some restrictions when it comes to testing because there's a shortage of testing. Is that something that you guys are doing here too?
So we want to take that.
We are following, we follow the guidelines, we follow CDC and we follow Department of Health. We haven't restricted it beyond that yet, but we are watching our testing supplies as a group, and we have talked about, is there a point where we would need to look at some kind of triage for testing? So obviously we have talked about anybody that's sick enough to be admitted to the hospital, people that have currently been admitted to the hospital, essential healthcare workers. Some of those most fragile patients are dialysis patients. So we are working through algorithms and procedures to start to have that conversation. We, like everyone, are watching the state and national markets in terms of how quickly they can get both additional supplies out and quicker turnaround times for everyone.
Do you have any idea on how many tests have you administered over the time? How many do you have? How many do you have left?
Yeah, I do. We've administered 21 tests. We've had one positive. We've had 2 negative results so far. The rest are pending, and we're waiting for those. And the number around again today we're pretty well situated. Okay, I have to do that, and I apologize. We actually are pretty well situated for probably the next foreseeable future on what we're seeing for our demand, but we are getting concerned. We're actually, the supplies we're testing to rule people out before we give the COVID is also being impacted, and we're working, I have to tell you, local, Linda is a great advocate for us to try to get into some of the state supplies. We're working with our legislators as well.
Have you put in any requests to get more? Just
daily, yeah, and I think one of our MVPs is our materials management director. She very early on started flagging for all of our supply chain to ensure that we had adequate supplies of what we need going into this. But it's such a fluid situation that I know everyone is still waiting for kind of better and more bountiful and quicker testing supplies.
This past Friday, when the confirmed case came into Adirondack Health's emergency room, it's my understanding that hospitals were required to get authorization from the state and county health departments before sending those testing elsewhere to get tested for COVID-19. Was that person's case sent out immediately for testing, or was it held until the risk criteria changed?
There was no holding till risk criteria changed, and we did notify the health department upon sending that specimen out. And we have a couple different options for sending out tests. One goes through the screening from the Department of Health. The other is clinician guidance and goes directly there. So we didn't have any delay relative to that.
Has the patient improved since last Friday?
I have not been the one checking in with the patient. I'll ask the Department of Health who's monitoring that.
So in reference to the patient and that discharge, it worked perfectly. That person was tested. They were put on precautionary quarantine, which took them out of the public. They were at home when they became positive. They got sick while they were home. They went back in and the test came back positive. It worked as well as it perfectly could have. The phone call was made, we quarantined them immediately, and when the test came back, they were where they needed to be. They've never left their home, and it's my understanding the patient is improving. Just so you know, we don't take that lightly, putting anybody in quarantine. She went from precautionary to now mandatory and into isolation because she's a positive case. We don't leave those people alone. Every single day, one of our staff is at every one of their homes, checking in there and eyeballing them, waving, talking to them. And then there's a second check-in, which is a phone call. We're asking them if they need anything, if they have a temperature, or that their needs are being met. I will also say in reference to supplies, Don Jaquish, we went through our emergency command center. Don Jaquish is working with the Office of Emergency Management in New York. Not just did we get our own supplies for us, but we've called every facility in Essex County and asked them what their supply needs were, and we're monitoring what's called a burn rate daily, how many they're using, so we can replenish them as we can. Our county government is working with those suppliers, and we're going to disperse them as those supplies come in, not just to our own facilities, but to all the facilities in Essex County.
How long does it take from like start to finish to get that test result back from when you administer it to when you get it? Is it hours? Is it days?
I'm going to stand back because I don't do those testing, and I like Dr. Claus. Would you like to answer that? I think it depends.
So right now, that actually, Ms. Beers is correct. It does depend, and it's in flux right now. We have several different avenues we can go to have a test done, and it varies from 1 to 2 days to 3 to 5 days, depending on where that test is sent and what's available at the time. And that's literally changing daily.
Now, if someone was more of like a high suspect case, would they kind of be put on a list to go faster than maybe someone who's not as high, or?
Pending availability, yeah. Just while I'm here at the podium, as usually happens, as I walk away, I think about what I would have liked to add to a previous answer, and we had a very good question about modeling and when this is going to peak in a month and a half or so. And the thing that brings to mind to me now is while we behind the scenes are preparing for worst case scenario and the need to take care of a large number of patients who are ill with this disease, the fact that this is going to peak potentially in a month and a half means that the time that we can impact that most effectively is actually now, when it seemingly doesn't have an impact on our lives. And now is the time to really optimize social distancing, hand hygiene, everything that we can do to try to minimize the propagation of cases throughout our community.
You guys might not have done too much because Trump just closed the border, the northern border. Will that have any effect, or is there any concern about maybe healthcare workers who live there and commute here? I'm not sure if there's...
So No, my understanding is that really was just a development this morning.
Right, yeah.
I know that in at least one, if not several, of our partner institutions, there may be an effect that has to be mitigated there. I am not aware of any direct effect here on this institution, Elizabethtown Community Hospital, and I would suspect probably not with our partner at Hudson Headwaters.
The only thing I would, and it does not have an impact on us, we are watching those supply chain that might come across the border. So just we're, as we mentioned, it's very fluid. It is literally hour to hour in terms of adapting to the changing conditions. So that would be the only impact that we've identified so far.
This may be a question you might want to direct to Congresswoman Stefanik's office, but I can tell you she's been in contact with all the providers and is looking at the impact. We do know that there are, as I found out this morning, there are medical personnel that do cross the border and provide services here, as well as some things like linens and stuff, evidently. And she right now is tracking that down to ensure that we don't have a hiccup in all those services and professionals.
This question might be for Mr. Gilliland. This disease is going to have an economic impact.
It is. It already has.
Repeat the question.
I'm sorry, you didn't finish. Go ahead.
It's going to have an impact on tourism. Is there any discussions at the county level of ways that the county can help residents and businesses get through this hard time?
I was actually on the phone this morning just before this with Senator Little, and she is working right now to get Essex County and probably the entire state of New York declared as a disaster area in order to open up fundings for private businesses and stuff to help them get through this. And I know in many of the towns and small towns throughout the county, they are looking at ways. They're through chambers of commerce, through development corporations, et cetera, to evaluate and see if these small businesses need loans. As far as tourism goes, that we saw the effect of that right away with the cancellation of so many events up there. Will it have a significant impact? Yes, it's going to. It already has having a significant impact, not only on businesses and stuff, but also on taxes and government and everything else.
Can I just follow? Have you done any analysis yet, or Mr. Palmer, as to the drop or projected drop in revenue?
I can give you some old data, old modeling of it. For this particular issue, but things change every day.
Right.
Okay.
I understand, yes.
We were looking initially when I asked for the data, and just for the High Peaks area, about a $44 million impact, and that would end up with about a $7 million impact on sales taxes.
Did you run that through the end of the summer, or what?
We ran that through the end of the summer.
End of August?
For what from the best information they had at the time. Yeah.
Thank you.
Yep.
So if there's no further questions, I appreciate all of you coming here today. Again, stay diligent. This is all in everybody's hands. We're all working really tirelessly and working hard to keep everybody healthy, and we really appreciate you coming here today and getting out our message. So stay home, stay safe, wash your hands, and social distancing. Thanks again for coming.